So I'm going to talk about the Affordable Care Act, and I'm going to talk a little bit about API communities. And I'm also going to talk a little bit about, since it's election season, politics and healthcare. And then there's something more about what's called the Patient Protection and Affordable Care Act, and some people derisively refer to it as the Obama Health Care Plan. And now President Obama actually is so happy about it that he now has adopted calling it Obamacare. So it goes to show how politics changes. And then I won't talk about the future look at medical practice, which will take too long. So anyway, about almost 5% of the U.S. population are Asian or Pacific Islanders. And in Philadelphia, our percentages are a little bit higher. So in the last census, I think in 2000, we had about 4.5%. And now we're closer to 6.3% of our Philadelphia population, and that's about 95,700 people estimated to have were Asian Pacific Islanders just in the city of Philadelphia. And the greater Philadelphia is certainly much higher than that. But the point here is that we're one of the fastest growing, not the fastest growing minorities in America. And that is of some importance because, when you grow in size and importance, people start paying attention to the needs of people in the API community. Now you can't read this, but basically in green on the right is the number of percent of people without health insurance. And you can see that health insurance is being uninsured is much more likely among Latinos and Hispanics and among African Americans. And about 14% of Asians are uninsured, so that's about 1 out of every 7 Asians. And so that's a significant number, and being uninsured in America is a significant problem for lots of reasons that I'm sure you're aware of. If you were to actually break down the number of people without health insurance, it actually varies. You can't read this, but it's on your sheet. It varies from one subpopulation of the Asian community to another. So among the Hmongs and Bangladeshis, for example, and among Koreans, the rates are higher for being uninsured. And lower rates are among more established Chinese and Japanese communities. But there is, in other words, great variability in the number of people without health insurance among the Asian population. And one of the reasons why it's important for us to sort of think of how we do our outreach programs to these different communities. So anyway, it's pretty clear that having some 14% of the population without health insurance, and among Latinos even much higher numbers, is a big problem. And it was the reason why we decided as a country to actually try to reform our healthcare system. And I want to sort of delve a little bit into the politics of it because it has a lot to do with what the Affordable Care Act became. So let me start by saying this statement, that there is no domestic issue in this country that is more politically divided than healthcare. No domestic issue. This is the one thing that every politician hates to talk about and doesn't want to touch again once they've touched it, because it is such a hot button issue. It's not like, supporting our soldiers, everyone supports that. But healthcare reform and how we do it, very, very contentious. That's more focused on trying to prevent illnesses rather than treating the consequences later on. One of the other important goals was to extend the life of Medicare itself. And the Medicare program was going to basically go bankrupt by 2016, and now it's going to go bankrupt in 2024. So it's still going to go bankrupt, but it's further out. And that's hopefully, by then, we will have other solutions for the healthcare system. And part of how we're going to fix that is to try new models of how we deliver healthcare and how we finance healthcare. So we created a new innovation center to try to test out these new models of healthcare. That's all part of the Patient Protection and Affordable Care Act. So when they say we're going to repeal the Obama health care plan, there are a lot of implications to many of these goals that would be affected by that. So how does the Affordable Care Act work? So this is in one page, the whole act, from its, in my mind, in a nutshell. So President Obama started off by saying that if you like your health insurance, you get to keep it. What he doesn't say is that if you don't like your health insurance, you still have to keep it. So whatever your employer provides you as health insurance, that's your health insurance plan, whether you like it or not. That's your plan. Second, and why did you do that? Because he does that because he wants to, or the Congress wanted to support employer-sponsored health insurance. Philosophically, that's why they did it that way. Second is that if you don't have health insurance, you're going to be required to buy private health insurance. And if you don't buy private insurance, and only private insurance, it's your only choice, you will have to pay a fine. So you say, well, that's not really fair, right? Well, if you're really poor and you can't afford to buy private insurance, we're going to help subsidize you. And there will be subsidies for people who are poor or near poor so they can afford health insurance. And for those people who don't know how to shop around for health insurance and buy it, there's going to be this new thing called a health insurance exchange. It's run by the state, and I should say that every state has the option of doing this, and if the states don't do it, the federal government does the exchange for you. And Pennsylvania, I should tell you right now, as we speak, is not going to do the health insurance exchange. They're going to do, probably hand it over to the federal government because time is running out, because they basically have to have this approved next year, which other states have already passed enabling legislation for this many years ago. There will be new changes to the Medicare program. There will be new regulations on insurance companies. Significantly for the Asian Pacific Islander community, immigrants are restricted or banned from this program. If you are undocumented, you cannot participate in the health insurance exchange, even with your own money. Even if you paid the whole thing out of your own pocket and you're undocumented, you cannot participate in the health insurance exchange. That is how contentious the issues of immigration is in Congress. And there is new major investments in prevention. Yeah. Yeah, wait to the end for questions. But I'm sure I'm going to provoke a lot of questions too. So I told you have to buy health insurance or you have to pay a fine. So how much is this fine? This part, incidentally, is the most controversial part of the insurance of the health, the Affordable Care Act. It's otherwise called the insurance mandate. Okay. So the fine, you have to basically pick in the Olympic spirit 4 different types of plans: bronze, silver, gold, and platinum. And they respectively cover 60, 70, 80, and 90% of the cost of your care. So, not surprisingly, if you want a health plan like a platinum plan that covers 90% of the cost of your care, what percent do you get paid? You pay 10%, right? If you have a bronze plan, guess who pays the other 40%? You do. You have to pay 40%. And anybody who's been hospitalized knows 40% of your hospital bill is not cheap. Not cheap. So people are going to buy bronze plans. That's the minimum requirement. You have to buy at least a bronze plan. And if you don't buy the bronze plan, you have to pay the fine. But if you buy the bronze plan, it's going to cost you tens of maybe $5,000, $6,000 for an individual. A family plan could easily cost you $12,000. And for that, you still get stuck with 40% of the bill. So people are going to say, well, how come I have a bronze plan? I thought it was health insurance. Well, guess what? It's not as generous as people might think. So the better the plan, the more it costs. Now I should tell you, the rest of the world, the idea that you would even spend 10% out of your pocket for health care is unthinkable. So basically the rest of the world has platinum health care plans compared to what we have in America. But that's because health care in America is so expensive, and that is an entire different lecture that I could talk about, which, take my class at Penn, and then you'll learn about all this. How much it's going to cost, but I'm going to give you an idea of how much it's going to cost in a few minutes. I told you, if you don't buy this bronze plan at the minimum, you have to pay a fine. And how much is the fine? Starting in 2014, just 2 years from now, it's $95. Not so bad, right? Or 1% of your income, whichever is greater. Whichever is greater. By 2016, it starts going up. $650 or 2.5% of your income, whichever is greater, up to $2,085. So it is conceivable that you could pay a fine of $2,085 and still be uninsured. But you do that because you don't want to spend the $5,000 or $7,000 for the bronze health insurance plan. Okay?
Is that per person or per family?
That will be per person.
Per person.
So
if you were married and you didn't want it and your wife didn't want it, is that be $4,000?
yeah. Well, that's a good question how that would work. Because that would be a huge amount of money for most families.
Right.
And it's being enforced, I should tell you, it's a question on your IRS tax form. So if you fail to buy health, if you don't certify that you have a bronze health plan, they will ask you that on your tax form, and they will add that fine to your tax form. Okay? So that's not, people are going to, people have the impression that we got quality affordable health care, but I can tell you right now, there's a price that you're going to have to pay to get this plan, and it's not as simple as most people think. It's not like Medicare for all, okay? Now you say, look, I can't afford the bronze plan. That's way too expensive. I hardly make any money. Well, if you're really poor, up to 133% of poverty, you're going to be enrolled into the Medicaid program. So a lot of poor people are going to get enrolled in the Medicaid program for the first time, and in particular, if you know Medicaid anything, the hardest people to enroll in Medicaid is if you're a childless adult. Like, if you don't have a kid, basically, it's almost impossible to get into the Medicaid program. So older adults, adults now can actually get in there up to 133% of poverty. If you're between 133 and 400% of poverty, you can get subsidized to get health insurance through the health insurance exchange. And that's on a sliding scale. If you make more than 400% of poverty, which is about $90,000 for a family of 4, or I think about 20 or maybe $30,000 for an individual. If you make more than that, you are deemed rich enough to be able to afford bronze plan health insurance, and you will have no subsidies at all. Now, between now and 2014, let's say you need health insurance. What do? Well, if you have actually a pre-existing condition and you've been uninsured for 6 months, and you have been turned down from getting health insurance because of your pre-existing condition, like you have diabetes and nobody wants to provide health insurance for you, you can actually apply for something called the state high-risk pool. So I'll show you that in a second. So anyway, under the Affordable Care Act, it is estimated that many ethnic groups will now get health insurance through Medicaid for the first time. And these are some of the increases. It's estimated about 9% of Asians will actually get health insurance with the expansion of the Medicaid program. And so 1 in 10 Asian Americans are likely to benefit from this expansion, and particularly among Bangladeshis and among the Hmongs, this would be a strong benefit. However, I would tell you that in the Supreme Court decision that was made, it was sort of, when they wrote the bill, they basically made it a requirement that states have to expand it. But the Supreme Court decision turned into an option. So states actually have the option of expanding Medicaid for up to 133% of poverty. And some states have already declared that they're not going to expand Medicaid, even if though the federal government for the first 3 years will pay 100% of the expanded costs. So this turns out to be a bit controversial, and therefore the Affordable Care Act will not cover as many people, I believe, as it was originally intended, because some states, for political and philosophical reasons, do not want to expand their Medicaid programs and cover their very poor citizens. Now, I mentioned this high-risk pool. If you're uninsured for 6 months, you've been turned down for a pre-existing condition by an insurance company, in Pennsylvania, you can apply for this high-risk pool. It's called Pennsylvania Fair Care. It costs $283 a month. That may sound like a lot of money, But if you have a pre-existing condition, try buying any health insurance at any price. You probably can't. So you can actually use this to get health insurance for yourself. And you better apply now because that money, first come, first serve, and it runs out. I'd be surprised if it hasn't run out already. This is the Health Insurance Exchange. And this is one of the great innovations of the Affordable Care Act. I should tell you that this was a plan that was originally approved in which state? Anybody know? Massachusetts, which was signed by Governor Romney. So people call this Romney Care, which became the model for Obamacare, ironically enough, which is another reason why both politicians do not want to talk about health care reform, because they have to reveal their past in talking about this. Anyway, if you go to Health Insurance Exchange, it's basically a website. You go to the internet. Now, if you say to me, I don't know how to use the internet, I don't have a computer, well, you know what? You're a little bit out of luck, frankly, if you want to know the truth, because this was all designed around the idea that you get, you can get internet access, and you can go to the website and then compare healthcare plans. And so you can choose from Blue Cross Blue Shield, a standard option, or an HMO, or something called health savings account, which I don't have enough time to talk about. Now, one of the new innovations about the health insurance requirements starting in 2014 is that insurers can no longer discriminate based on pre-existing conditions or whether you're a female or male. They can't charge you more because you're a female. They can only discriminate based on 4 things. How old are you? Where do you live? How big is your family? And do you smoke? So don't smoke. All right? Otherwise, they can raise your rate. But if you smoke, your family size, your age, and where you live are the only criteria they can underwrite your health insurance plans. Every state must offer at least one nonprofit plan, otherwise known as Blue Cross Blue Shield, and they have to offer at least one plan that does not pay for abortion. That was the compromise they had to make to pass this bill, because abortion is such a controversial issue in our Congress. Now, it turns out Massachusetts has such a health insurance exchange called the Connector Authority. For a month and a half every year in the summer, in July, you can actually go to the website and you can pretend you're a Massachusetts resident and you can type in your family size and your income, and then they will tell you how much your different plans are. So I did that, and I show you that I have a family of 3. Now I have to say I'm in my 50s. So I'm older than a lot of you guys who probably could get cheaper healthcare plans. But for a bronze plan, for a family of 3, it will cost me, the cheapest plan would be $1,094 a month. A month. So that's talking about $1,094, you're talking about $12,000, $13,000 a year to buy a bronze plan. And it will come with a $2,000 deductible, $4,000 for the family. Every time I go to the emergency room, it will cost me up to $150. I have to pay for the first $150 before, and then I have to pay the deductible of $2,000 before I actually get any coverage for my emergency plan. Every time I get a doctor's visit, it's going to cost me $30. Every time I get a generic prescription drug, it's going to cost me $10. It's even more than the $4 you get at Walmart now. So in other words, it's not a very generous plan. And for that, it's going to cost you $13,000. But that's what the family plan would cost our family, and I would be required by law to purchase this health insurance in Massachusetts. And that's probably similar to what the plan will look like in America, too.
That's only 3 days in the hospital.
That's
$13,000.
Yeah. So actually, compared to what hospital bills are, it's actually, that's how much healthcare costs. So you have to charge that much for a health insurance plan. Now, it is true that many of the Asian Pacific Islanders will benefit from this program under the health insurance exchanges, and it varies from different groups, particularly among the Bangladeshi, the Hmong, and the Koreans. Population will do better because they have higher numbers of people without health insurance and are more likely to qualify for subsidized health insurance through the state health insurance exchanges. Now, in exchange, well, that's sort of like the bad news and good news, depending on how you interpret it. In exchange for that, we're changing the rules of how insurance is done in America. So they can no longer exclude you for pre-existing conditions. There's no more medical underwriting. There's no more rescissions, which means that you can't say on your application you failed to declare your acne, and now that you have breast cancer, we're not going to pay your medical bills anymore. They can't do that anymore. There's no more lifetime caps on your claims. So if you're a kid with hemophilia or cystic fibrosis, and it costs $1 million to take care of your kid, they can't say it's capped at $100,000 and we're not paying any more of your medical bills. Your kids can now stay on your parents' plan up to age 26. That change alone, for the first time, changed the number of uninsured in America downwards for the first time last year in the sense. Every year, the number of uninsured goes up. We had something like 2.5, 3 million kids who got health insurance for their parents' plan because of this provision. You must now pay at least, insurance companies now have to pay at least 80% of the premiums that they receive toward medical claims. So they can't afford, 30% marketing overhead. If they do, they have to, guess what? They have to give a refund back to their employer who paid the premiums or to you as an individual. So for the first time this year, something like $1 billion is being refunded to the American people because the insurance companies have been charging too much money. And now insurance companies have to actually disclose their payment policies and so on. And there are some Republican ideas. So one of them is, of course, that you can only buy private insurance. They adamantly, totally oppose the idea of what they call a public option, or something that the government could actually create a competitive plan to private insurance. Health savings accounts are also part of the health insurance exchange, which I won't go into. And they also wanted some state demonstrations on malpractice. And of course, they wanted 100% restrictions on any plan that could pay for any abortions in America. So that has all been cut out. How are you going to pay for this? Well, the bulk of it is paid for through your employers, through employer-sponsored health insurance. Starting in 2018, if any employer provides what they call Cadillac-type health plans, that is to say, a family plan that would cost over $12,500, or an individual plan that costs over $10,500, if they offer that, for the incremental amount over that amount of money, the employer will have to pay a 40%, not 4%, not 14%, a 40% excise tax on that excess amount. So what does that mean? It means basically any employer, no employer in America is going to offer you a very generous health care plan after 2018 because they're going to have to pay this enormous tax on it, and they don't want to do that. Why would they do that? Because one of the arguments are that people misuse generous health insurance plans. That if you actually have a generous health plan that pays everything, co-pays, deductibles, and all kinds of hair removal and all kinds of other stuff, that you'll take advantage of that and you'll use it, and that's one of the reasons why healthcare costs are going up. So the philosophy here is that by not offering overly generous Cadillac, what they call health insurance plans, it will force all of us to be a little bit more conscious about how we spend the employer's health care dollars. Now you may agree or disagree about this, but this is what the Affordable Care Act states. If you're rich and you make more than $200,000 a year, and I'm sure a lot of people in this room are like that, your Medicare tax is going to go up this next year by, right now it's 1.45%, I think it is, and now it's going up to 2.35%. And for the first time, we're going to actually tax you on your investment income. So you make all that money from stocks and those dividends, that money, if you're rich, over $200,000 a year, you're going to have to start paying investment taxes to help fund the Affordable Care Act. If you're an employer, you have more than 50 workers, and any one of your employees decides to get their health insurance through the health insurance exchange, you will pay a $2,000 fine for every one of your employees after the first 30 employees. So why would they do that? Well, they do that because you as an employer, if you have over 50 employees, you should offer a health insurance plan that is at least generous enough that none of your employees would ever have to go get subsidized health care through the health insurance exchange. That's meant to protect the taxpayers of America. There are going to be cuts to the Medicare and Medicare Advantage program, and there's something called an Independent Payment Advisory Board, which I don't have time to talk about, which basically is going to have the power to regulate doctor fees and hospital reimbursements. So these are ways in which they're going to try to reduce healthcare spending.
Isn't that 2,000 no less than what they would pay for the health plan?
Well, that's an interesting point,
Yeah.
because $2,000 sounds like a lot of money, right?
Right.
But what about the idea that, you know, for these employees, they're paying maybe $5,000, $7,000 for their health insurance, employees? So actually, it might be a good deal. They could say, I'll pay the $2,000 fine, I'm going to drop their health insurance, and you get your health insurance through the health insurance exchange from now on after 2014. And there's some debate about whether people might do that. Sears and some other company yesterday announced that they are going to do what they call the defined contribution plan, which means that they will no longer provide health insurance for them. They're going to give a dollar amount to their employees, and they have to go shop around and buy private health insurance on the marketplace. And whatever they can afford to get from that, they can get. If they want a more generous plan, they have to come out of it and pay for it out of their own pockets. So this is Wall Street Journal published an article saying that this could be the beginning of an interesting change in employer-sponsored health insurance in America. Watch out, just pay attention, because this could be a different world. You might say that's not a good thing, but on the other hand, if you think about it, employers should never have been the ones who've been sponsoring health insurance in the first place because of all kinds of problems that are happening with employer-sponsored insurance. Now, one other thing that is relevant for the Asian Pacific Islander community is that we're going to have better data. So the Affordable Care Act actually requires collection of race, ethnicity, sex, and primary language as part of the health insurance plan. So we're actually going to learn more about how the bill is affecting different subpopulations in healthcare. When this is all over, this is before the Supreme Court decision was made, it's estimated that we would have had 54 million people without health insurance by 2019, but because of the Affordable Care Act, it will be down to 23 million uninsured. Where is the growth of people with insurance going to come from? It will come from the expansion of the Medicaid program, although some states have chosen not to expand the Medicaid program, as I explained, and it will come from the health insurance exchanges, which is an internet site that you will go to where you can buy the bronze, silver, gold, or platinum plans. This comes at a cost, because if you ask insurance companies that you no longer can exclude people for pre-existing conditions, there's no lifetime caps, no rescission, all this other stuff, health insurance premiums are going to go up, not surprisingly, right? So, but it's not going to go up, but it's going to go up, but it actually for some people are going to be kind of winners on this issue. Who might be winners? Or if you're near retirement, you're not on the Medicare program yet, let's say you're 60 years old, your health insurance is probably pretty expensive. And for you, your insurance premiums are not going to go up as much as young people who are going to probably pay a higher cost for the health insurance plan than they normally would have if they had done what they call experience-rated health care. It's a long explanation, but it's all inherent in how private health insurance works in the country. So my overall impression about the Affordable Care Act is it is incredibly complicated. It's complicated because we made a decision that we don't like government in this country, and we only like private sector. So we chose sort of the private sector route to solve this solution, but inherent to that are many other ramifications about how private insurance works. So we've created basically a requirement that you buy private insurance, but we're going to put all kinds of new restrictions on private insurance, and we're going to put some new requirements on you to purchase private insurance. Many people, as much as I've tried to talk about this, are going to have no idea what the hell you're talking about. This is totally difficult to understand. There are many good, bad, and ugly stuff about the Affordable Care Act, frankly, but overall, one of the hard parts in this country to do is to try to expand access to health care And we're doing that in the country, and we're going to do a lot more starting in 2014. But we do that at a price of doing new insurance regulations. And one thing that I did not go into much about this, because it would take another whole hour, is to talk about the new prevention and public health agenda that's part of the Affordable Care Act, because that also has some great implications. There's a new prevention and wellness fund, originally designed to have $2 billion. Now, anyone who works in public health will tell you, we've never had anything like $2 billion to invest in prevention. That actually is part of the original act. That already is under attack in Congress, and they're going after that money to try to remove it in order to fund some other programs. So watch out. The Prevention and Wellness Fund is something that could be a great thing for public health, but it's also under great attack right now. So I have talked a long time. I probably confused a lot of you, but I'd be happy to answer any questions.